Thank you so much, guys, for sticking with us throughout this entire conference. One more huge round of applause for AHP for putting this whole thing together. It's been absolutely amazing. And if Linda Frazier is in the audience, if everybody could give her her own round of applause. She probably has not slept for the last 3 weeks. I'm going to be brief on, first of all, you know, that was almost half of a dream come true, being told that I represent the United States. The other half is that I'm at the Olympics and not at the North American Cannabis Summit, but that's okay. But it is kind of the elephant in the room on this one, which is how does a guy who has a consulting firm of 3 people become representing the United States? And that's because there's a vacuum at the federal level on this. And I think it's something we should really be acknowledging, that I think there's an amazing thing happening with the laboratories of democracy right now and what we're seeing on the state level. But considering how much this could affect so many people and so many people's lives, the fact that there's no leadership on the federal level, even any sort of vision about where we're going, is appalling. And we should acknowledge that. The opportunity that gives us is to, for once, not see ourselves as leaders in this area, but be here to listen. I'm under no assumptions that when this finally does hit the federal level that they will be great listeners, but one of the things that can start here on the public health level is realizing that the people that are going to lead the way this is done is the rest of the world. So I, for one, am excited not to hear about the United States vision of where we are going, but to hear the vision from these two. So I think for once, let's become listeners instead of telling everybody what the right way of doing things is. So thank you for having me.
Thanks, Andrew. So as Dan introduced, my name is Krista Apse. I work for the Cannabis Legalization and Regulation Branch in Health Canada. You heard from my colleague Hanan this morning about data and surveillance. I think, Hanan, you're still out there, who talked very eloquently about our objectives, or the government's objectives, in setting forth on this mission. And so I'll just take a minute to maybe set the stage for what is happening in Canada, because over the course of the last couple of days, I've heard a lot of different things about what people think is going on, and much of which is correct, but let's just start from a common point. One is that there's 2 main objectives that our political leaders talk about, and that's keeping cannabis out of the hands of youth and keeping organized crime and criminals from profiting from its sale. And every other objective rolls from those 2 main ones. There's a bunch of other things that we think about in terms of minimizing harms, in terms of making sure that we're measuring the impact, making sure that there are appropriate criminal sanctions and that sort of thing, but everything stems from those 2 main objectives. And so what I haven't said about that is that the taxation, the revenue component, wasn't what motivated the Canadian government in setting out to legalize, restrict, and regulate cannabis. Hanan also mentioned this morning that we've been at this for a little while. So there's been quite a bit of dialogue in Canada, and that was very deliberate. This is a transformational initiative. This is something that we as a society have to take seriously, that has implications for a number of different areas, as we can see from the audience and the variety of people here. And so that dialogue started in 2016 with a task force that provided the government with advice. And so that was a very deliberate public dialogue that set forth some of those public health objectives in minimizing the harms and risks of cannabis. When we say legalize cannabis in Canada, we also usually add legalize, restrict, and regulate access. So that's usually said together, and sometimes we even drop the legalize. We usually say regulate and restrict access. So the public health approach, what does that actually mean in Canada? I'll give you a little bit of a short overview as to what the law looks like. I'll talk a little bit about public education and what we have done there. I'll skim over the surveillance and monitoring. Hanan did a great job about that this morning, but that's an important component as well. So in terms of the law, when I say restrict and regulate, it really does mean that cannabis is a little bit less illegal. And so there are already a number of prohibitions in place, and that continues. It just means that it's a little bit less, it's less illegal for some people. So adults who are over the age of 18 or 19 in some provinces are able to possess 30 grams of cannabis. They are able to legally purchase it, go into a store and purchase it. But that also means that there's a series of prohibitions in place. There's prohibitions on advertising and marketing, and it is true, I think it was on day 1 or day 2 where I heard somebody talk about the prohibitions that we have in place, and they are indeed significant. No health claims about cannabis. There can be nothing that's appealing to youth. We have considerable requirements for plain packaging, requirements for labeling to make sure that THC and CBD are included on the packaging, and health warning messages. So I think I've illustrated a few things. If you're interested in here and looking at more, there's much more on our website that does it in a succinct way. But you get the idea. Another thing that we started pretty early, and this was advice from people like Andrew, like our friends in Colorado and other friends in Colorado and Washington, who basically said to us, listen, there's a couple things that you need to do early before legalization hits. One is public education, because you're moving your population from an uninformed consumer to ideally, when the time comes, an informed consumer, should they so choose to be a consumer. And the second thing was around data and surveillance and having that baseline. So on public education awareness, I'll remind you, we started the dialogue in 2016. By early 2017, we were already out there with some key messages around cannabis. We had just introduced our piece of legislation. It hadn't yet passed, but we were nevertheless out there on drug-impaired driving, on health effects and health risks, and we've built from there. And we've done that a number of different ways, some of which has been really creative and awesome. Others have been more traditional. And like many of you have described, the challenge of making sure that we're actually reaching our audiences like youth. So I'm not a youth anymore, but we have to rely on people who can tell us how to do that. But in addition to that, our political masters also aren't youth, and so there's an expectation that they are receiving that information as well in the ways that make sense for them to receive it. So it was a pretty broad campaign that launched last year, and that will continue. As I said, Hanan talked about surveillance and monitoring, but that's another important aspect of our work. One final thing I will say that's an important piece of context before I close off is that we haven't done this alone. So this isn't only the federal government working here, it's together with our provinces and territories. So the federal government is responsible for overseeing production and cultivation, for overseeing to make sure that we've got national standards for products, and provinces and territories are responsible for setting up retail and distribution. So I know that I have a few colleagues here from the provinces and territories. We started work with them really early on. So again, I think it was early 2016. We've been meeting with them every 3 weeks since that time to coordinate, to share information, to make sure that we're all moving together on this. So it's been a fairly complex environment, but one where there's been a lot of collaboration. And I think I'll leave it there.
Buenas tardes. I am happy to share the table with Krista and Edward. Andrew, thank you for your time. It's a pleasure. And I would like to thank the organizing committee, Neil, Linda, Lydia, and Sarah, for their wonderful job in the arrangement and realization of this international gathering to exchange views and ideas on current issues and common concerns across North America in regard to cannabis use. It is very important for the National Commission of Bioethics to be part of this gathering in light of the new scenario that is taking place in Mexico, which pose a series of opportunities and challenges that require our attention. I'm very grateful to the Secretary of Health, Jorge Alcocer, for his support to be here. As for the context of the social transformation concerning and occurring with regard to drug policy, we must first take in account the fact that over the last 2 decades, our country has suffered greatly the outcomes at the front of the war on drugs with no encouraging results to show for it. During this period, when faced with the new problem of the regulation of illegal drugs, a deontological framework was adopted by most countries in the world. That is, an approach that placed greater emphasis on the aim of or the principle guiding an action rather than the outcome in itself. As a result, a global drug prohibition policy was implemented despite the fact that the production and consumption of illicit drugs, deaths, disease, crime, and official corruption increased constantly. The process of regulation and legalization in Mexico, we started with 2 groundbreaking developments in 2016. First, the permit granted to Grace Elizalde, who was diagnosed from an early age with Lennox-Gastaut syndrome, to import a drug containing CBD for her treatment, and on the other hand, and the protection granted by the Supreme Court to a civil organization, allowing cultivation, production, and recreational use for non-commercial purposes. This cannot be understood without considering the constitutional reform that was set out in 2011, establishing all the international treaties on human rights that have been adopted by the Mexican state as overriding policy. This reform has been key in framing the analysis of emerging issues and challenges in health, especially in the field of life and health sciences. It was along these lines that the first public consultation process to update the normative framework surrounding marijuana was carried out in 2016. As an outcome of this process, the federal legal framework was reformed in June 2017, establishing the legalization of cannabis for medical purposes, and provisional regulations were issued in October 2018 to set for the criteria for conducting health research with human subjects, as well as medicinal and industrial use of cannabis. In the same year, there was a ruling from Supreme Court stating that provision of cannabis use for recreational purposes is unconstitutional on the grounds that it undermines the general right of freedom of personality, a development that has paved the way for 5 persons to receive protection for recreational use of cannabis. In this prospective analysis, we must consider that there is a draft bill for the regulation and control of cannabis that is currently under review in Congress. Following the argumentation of the Supreme Court of Justice, this initiative was developed by the ruling party to set forth criteria for both therapeutic and recreational use of cannabis at the federal level, endowing the state with attributions to accompany the market with information, establishing minimum standards, monitoring, verification, and evaluation. There are adjustments to be made to the draft in order to guarantee harmonization with the federal and legal framework. However, this new regulation is expected to be approved by the second semester of this year. The landscape for the regulation of marijuana in Mexico in recent years has reached a turning point, setting bias aside and considering the latest scientific findings with regards to cannabis. We are currently working closely with health and human rights authorities to ensure that the new regulatory model set forth actions to prevent the consumption of drugs, especially marijuana, through campaigns aimed at children and young people, as well as implementing a comprehensive care model with a focus on harm reduction, establishing institutional strategies to mitigate the effects of abuse, which include minimizing access and availability among young people and other vulnerable populations, as well as analyze and reduce the burden of disease, tackle health risks in adolescents, and implement effective actions for the treatment of addictions. The national health system in our country aims to comply with the right to health protection, so one of its fundamental premises is to fulfill access to all therapeutical resources that derive from scientific development worldwide, among which are, of course, the pharmaceutical components derived from cannabis. However, the use of this medication requires in itself clinical research to support their effectiveness and safety. As for the social context of cannabis consumption, it cannot be overstated that Mexico could benefit greatly from cannabis regulation by removing an important source of revenue for criminal organizations, especially considering that our country is a major producer in regard to marijuana, heroin, and methamphetamine, which is distributed internally at retail and also trafficked internationally, along with cocaine produced in the Andes region. The effect of legalization on public health and human rights has a direct correlation with the implementation, since many aspects of regulation pose public health implications. When implementing the process of regulation, modifications and interventions must be introduced in a gradual way, while tempering and evaluating their impact. Policies must be evaluated with transparency on the basis of their results, both positive and negative. I would like to stress that this approach of transparency on the basis of the results, while considering the participation of well-informed citizens through debate or common deliberation in order to adjust or modulate existing policies that may be ineffective or subject to improvement. There are many effective measures that could contribute greatly in preventing an increase in consumption among the population, such as regulating the price of cannabis to avoid a drop in retail price, or limiting access to consumer cooperatives, as well as strengthening prevention through targeted campaigns. Considering that there is an important gap with regard to our knowledge about the consequences of using high-potency cannabis products, taxing cannabis concentration may represent a good measure to avoid health risks until further evidence is established. The main goal for regulating cannabis in Mexico should be to grant personal freedom while restricting access for children and young people, cutting off revenue for organized crime, as well as ensuring quality and safety in cannabis products. Historically, the reason why some drugs are deemed legal and others are not are completely unrelated to science or health, but to the social perception of the people who consume it. The motivation behind the first laws against marijuana, written in 1913 and 1914 in California and Utah, were actually set to regulate the entry of Mexican immigrants. The first regulation of opium, likewise, it is related with migratory flows from Asia to the United States, and with regard to cocaine, regulations discriminated against the African American population. In general, the proportion of people who have experimented with drugs has increased worldwide, and also most people quit consuming eventually. The number of users who develop dependency has risen in the last years. In this regard, I would like to remark that the social dimension is key in order to tackle addiction. What has proven most effective in order to overcome this burden consists of introducing adjustments to the social environment, as well as strengthening interpersonal relationships and ties with the community. Bioethics, as an interdisciplinary framework for analysis of emerging issues in health and human rights, offers a comprehensive approach to health, providing criteria to weight the public health interventions, which include prevention with a focus on risk factors for vulnerable groups, timely detection, referral, treatment, and rehabilitation. The National Bioethics of Mexico has undertaken the task of fostering reflection on the social, economic, and health aspects of cannabis regulation, considering a scheme based on respect of human rights and synergy among nations. We celebrate the spirit of this meeting, which fosters an impassionate and interdisciplinary analysis of the outcomes of cannabis regulation from the perspective of Canada, Mexico, and the United States, which have different motivation, but also a common concern for the well-being of our people. Muchas gracias.
So a few questions we have prepared ahead of time that I think we thought would do the best of communicating to or starting a conversation that would ignite your thoughts. But we will quickly open it up. And I don't know, Dan, are you going to be walking?
There we are. Sorry about that. So I think I'm going to pose a couple questions to the panel, and then we'll open it up to everybody. One thing I wanted to ask is, since you folks have had a chance to attend the conference this week, and from where you sit on the world stage, what do you think we've learned here this week, and where do you think we need to direct our focus next as we all leave here and go back to our work?
Yeah, I can start. So I'm going to crack a little bit of a joke, and this is by no fault the organizers, but if you take a look at page, I think it's 17, I am the anonymous, faceless person that's on page 17. So I'm going to talk about this from a bureaucrat's perspective. I'm part of the public service, so it'll be pretty politically neutral. So this is what I would encourage you all to think about. We have knocked on many doors looking for information, for best practices, for things that have worked in terms of public education, for things that have worked around regulations. Some of you, I think we've even talked about, things like mandatory pesticide training. There has been no shortage of graciousness, of time that you have all shared with us when we start looking for that information. And that will only continue. And I think the main point is that kind of collaboration needs to continue. And so the last 3 days have given me a bunch of new ideas on some of those topics, but there will be more. And I know sitting as a country, we regularly receive the same kinds of requests. And so it has been happening to us for years now on the cannabis for medical purposes side. But increasingly, we're starting to have quiet knocks on the door from other countries who are in Canada, who have sent delegations to Canada to understand better what we're looking at in terms of our regulation. And so I would encourage all of you to maintain that openness, maintain the willingness to answer questions from colleagues who are struggling with some of the same issues that you have done so a few years ago. I think it's fair to say that there are many pioneers in this room, and we can pat ourselves on the back, but that doesn't mean our work is done. We should continue to share and be generous with our time, be it regulators, be it members of the public health community, communications experts, researchers of any kind. This will only continue as this dialogue opens up even further.
I've been heartened, frankly, by the progress of the public health community since if you go back from the last NACS till today, what I'm seeing is everybody's actually putting their sweat equity into what's going on, and we are 3 levels deeper into the problems than we were 3 years ago, where the idea was, why aren't we getting together and sharing data? A lot of what I've seen this week is the result of what happens when you get together and you share data, and we are getting closer and closer to actually actionable regulation, suggestions for regulation, suggestions for programs that I think you are actually seeing in the law. So that's the part that really heartens me. The other part of the shift in vision, and this is speaking a little bit from the United States side, but I don't kind of know where else to do it, is, and I've been approached about this being part of the problem on this as well, is we are definitely letting equity be the tail on the dog on this, we consider equity, but we always consider equity last. Equity is always a theme that comes in kind of as an afterthought of what's going on. And I had a few people say some very intuitive and insightful things to me, but the biggest is we really should watch who's at the table throughout this entire thing, because if it's not the right people at the table, equity is always going to be the last part of the conversation. So that would be my challenge moving forward, we have done a lot of what I mean is remarkable professional work where we are looking out for our communities. I'm not sure we've set the table exactly right. So that would be what I see.
I think that it's very important to build confidence in society. I think it's the first step that we have to do. And I think that to bring the stakeholders together and to discuss and to implement ways to know what's going on